If you are overweight, for every pound of weight that you're over, it is 60 pounds of pressure. So we take pride in a very integrative and holistic approach in helping our pain patients, even with nutrition. Hi, Dr. Joyce Martin, nurse practitioner and chiropractor. I'm here with Anthony Spardello, our holistic nurse.
Hello.
And today we're going to talk about why your knee pain, hip pain, shoulder pain just isn't getting better, why you're having this persistent inflammation. It is my belief and the beliefs of a lot of practitioners that inflammation is the root cause of a lot of disease and illness, especially we all know with orthobiological problems, it is the inflammation. So, does that sound familiar after you've been through physical therapy, you've been to the doctor, you've had cortisone injections, and speaking of cortisone, it does degrade the joint. You're usually only allowed so many in a year or a lifetime, but there are so many things now that we'll talk about in a little bit that are so much better for you, and they can actually reverse your pain and get you functioning more. Anthony, so there's reasons for this. Can you talk a little bit about the patients that we're seeing with the persistent inflammation? And a lot of the patients haven't had an injury. It's just from arthritis and just overall inflammation.
Inflammation, yes. So that is a huge factor when it comes to this joint pain. Ongoing inflammation inside the body. So inflammation is a huge factor when it comes to our patients. There's ongoing inflammation that's within the body, even after trying your PT, trying all those other therapies for you. We have to get that inflammation down. Now, where's that inflammation coming from? It can be systemic inflammation all over the body. It can also be inflammation caused by some foods you're eating. So we do a whole nutritional plan as well with you when you do anything regarding your joints, because we want to make sure that you are eating correctly and that you are going to heal the best, both for your health and for the health of your family as well, to see you healthy.
As the cartilage wears down, the joint surface becomes irritated. And that's where we can make a difference with a lot of different therapies. The repair process is a process, but it can happen. And we see life-changing experience with so many patients. And, you know, body weight does translate into the pain syndrome. If you are overweight, for every pound of weight that you're overweight, it is 60 pounds of pressure. So we take pride in a very integrative and holistic approach in helping our pain patients, even with nutrition. And over time, mechanical stresses can accelerate that cartilage and inflammation damage. So you really want to nip that in the bud, and that's where the regenerative strategies become very, very important in regenerative medicine.
Yes, we have to rebuild this joint from the inside out, and that's what we do with the regenerative medicine. There's a few different modalities and ways that we can do this rebuilding of the joint. We like to use a PRP, platelet-rich plasma. We also use stem cells. We use peptides. So there's a bunch of different modalities that we can use to help you feel better. And depending on what is going on with you will depend on your treatment. It's all customized to you and how to get you feeling better. We don't group everybody into a box saying this worked for one person, it's going to work for you. No, you're an individual yourself, and that's how we treat you, and that's what we're going to do. We're going to formulate a plan just for you that we know can get you to succeed.
And you know, chronic pain is a tissue problem. It's just not a pain problem. And that's what we need to address. And I'm very excited to say in this country now the FDA is regulating stem cells. So we actually can do them here. Patients don't have to go out of the country, which is always an added expense for them. So also we have regulatory agencies such as CLIA in this country where they're looking and regulating our laboratories. So it's amazing. It's much safer, and patients are seeing incredible improvement without having to go out of the country.
So all our products, they do come from FDA certified labs and everything like that. So we know it's the best product that is out there.
Also, inflammation with aging. Inflammation is aging people. So combating that inflammation is the most important thing you can do for your whole body. You know, we even have systemic IVs that can help with exosomes, and that is also regulated, which is very important to us. So most people think inflammation, redness, swelling. That is not it at all. It is really underlying. It's the underlying root cause of patients' illnesses and pain. So if you could just elaborate on how we see it really affecting the body with like the slow wound healing and the work we've been doing with advanced wound healing.
Yeah, so we do a lot of work, advanced wound healing with patients that have diabetic ulcers, decubitus ulcers, venous ulcers, pressure sores, you name it. We can treat it with our wound care teams. And we see a lot in wound care that inflammation in the body delays proper wound healing. So a wound that would maybe normally under conservative care done by us heal over a 2-week period, when that body's under constant inflammation, it may take double that time and actually to heal properly. So that inflammation in the body has to come down before we can properly heal anything that has to do with the body, especially when it comes to wound healing.
So regenerative and biological medicine is the answer to the tissue problem, which is what is happening with all of the inflammation. So give us a call. We're at Regen RX in Cranston and North Kingston, and we're going to look forward to helping you and your loved ones.